technical topics. My subject name is the types of adverse events. Adverse event and adverse drug reactions. That is, the adverse event is unwanted medical occurrences that may be present in drug treatment is pharmaceutical products. It does not necessary in the causal relationship with the treatments. And A is the adverse event, effect and experience. And adverse means the untoward, unintended, possible causal harm is noxious. And ADR is the adverse drug reaction in which is the causal association with the suspect in the drug and events. And ADE is the happening technique of drugs. EE means an adverse drug is the noxious of changes which is suspect due to the drug and occurrence in doses normally with the required treatment in decrease in the doses and indicate use of the future of the same drug. And that means is the adverse drug reaction is the which is the possible in the causal relationship between the drug and event. And A is the may or may not be or may without be causal relationship. And causal relationship and causal relationship. And types of intensity is the mild and nose minor and mid moderate and severe. This is the intensity types. And seriousness, serious and non-serious, expected and unexpected, and causal relation related and unrelated. Types of adverse events. And various adverse drug reactions that is occurring in adverse events is the symptoms of nauseous, vomiting, diarrhea, depression, thyroid disorders, and skin rashes, blurred visions, and gastro or pain of in abdomen. And classification of ADRs. ADRs in depending upon severities. Minor ADRs is no therapy. This is the mild, and antidotes of prolongation of hospitalization is required. Moderate is at least the 1 day is the hospitalization treatment requiring changes in drug therapy. And severe ADRs is potentially is the life-threatening. Causes is the permanent damage of require intensity and medical treatments. And lethal is the mostly is death. Fatal is directly and indirectly contributes of death of the patients. And drug is classification of ADRs is onset of event. That is the 3 types. First type is acute. Acute means the more than 60 minutes, and subacute is the 1 to 24 hours, and lethal is the more than 2 days. And types of drug reaction. This is the type A, type B, type C, type D, type D, type E, type F, type G, type any type H, and type U. This is the type drug reaction. And other is other side effects. This is the other type 6 side effects. Toxic effects and toxic effect, drug allergy, drug dependence, drug introduced disease. This is the iatrogenic, mutagenicity, cardiogenicity, and drug withdrawal, photosensitive, drug relation, intolerance, and drug effects and secondary effects, adenosynergesis. This is the type of other drug reactions. And mostly the drug administered develops in new conditions and symptoms of ADE. And then drug suspected and checking the literatures. This is the standard document is checking, and documented is the highly in of ADRs and not documented in literatures. This is the 2 types as the drug continuous and drug discontinued. Drug continuous is the symptom sciences and any possible cause, any possible of causes as concomitant therapy and a underlying conditions. Drug discontinuance is the system science is the positive challenge and positive occurring the Rechallenge. This is the positive rechallenge is the restarted of drugs symptom signs and classification of ADRs it depending upon the drug depending upon the types of symptoms seriousness of criteria. This is the result in death occurring in the result is death. First is the date, नंतर hospitalization of prolongation of existence of prolongation and causality and incapacity and conjunctive of birth defect and medical significant and medical significant and classification of will and bonds depending upon the type of A is accumulated which reaction which means predicted from the occurring in the pharmacology of drug and actions and dose dependent and a dose reduction and that is for examples of the anticoagulant is the bleeding and nitrates is the headache and beta blockers is the bradycardia. Bradycardia is the abnormal heart rate and types B is the bizarre reaction. This is the cannot be predicted from the pharmacology of action or drugs and this is not dependent of drug and this is the word host dependent. For examples of the anticonvulsant is the hypersensitive and penicillin is the anaphylaxis. This is the allergic condition and these types of C is the chemical reaction. Biological characteristics can be predicted from the chemical structure. This is the metabolite of can be structure of drug is this metabolite. For examples of the paracetamol is the hepatotoxicity. Hepatotoxicity means the abnormal function of liver and accumulation of drugs and paracetamol is more drug uses and types of D is delicate reaction occurring after many years of treatment can be due to the accumulation and for examples of the chemotherapy C in a secondary tumor. This is the cancer types and phenotype during the pregnancy, teratogenic effects and antiparasitic statistics. Analgesics is the nephrotoxicity. Nephrotherapy is the kidney abnormal function and type E is the end of treatment. This is the stop of drug occurring withdrawal especially when the drug is stopped. For example is phenotenia withdrawal seizures. Thank you.